Prospective study of the ENOS gene, an intron variable number of tandem repeat functional interaction. Introduction. Erectile dysfunction is a common condition in patients with cardiovascular disease, and it has been observed that genetic factors can influence its onset. This article addresses the relationship between erectile dysfunction and certain polymorphisms on the endothelial nitric oxide substance (ANOS) gene in patients with cardiovascular conditions. The analyzed polymorphisms are P786C and JA940. Property story aim to explore the functional interaction of these polymorphisms and their implication in erectile dysfunction in these patients. Development and argumentation. Erectile dysfunction, a condition characterized by the inability to achieve or maintain an erection firm enough for sexual intercourse, is common in people with cardiovascular disease. This is because both conditions, ED and endothelial dysfunction, and the alteration of nitric oxide mediates vasodilation. Nitric oxide plays a crucial role in the relaxation of the small muscles in blood vessels, which is essential for erection. In this context, the ANOS gene, which encodes the enzyme that synthesizes nitric oxide in the vascular endothelium, has been identified as a key candidate in the development of both cardiovascular disease and erectile dysfunction. The study focused on three specified variations of the ANOS gene. This polymorph is the promoter region and gene has been associated with a decrease in nitric oxide production and therefore with a higher risk of the endothelial dysfunction, which is an underlying factor in erectile dysfunction, and this polymorphism is exon 7 of the ANOS gene, which affects enzyme function, has also been linked to reduce nitric oxide synthesis activity.
The article presents a systematic review of the prevalence of sexual dysfunction in patients with cardiovascular disease. Grants important topic in medical research by analyzing a range of studies. The review highlights the significance of addressing sexual health as an integral part of the treatment for CVD. One of the most notable findings of the study is that sexual dysfunction is common among patients with CVD, affecting both men and women. For instance, a high percentage of women with aortic occlusive disease reported is research as lack of vaginal lubrication and orgasmic disorders, indicating that cardiovascular health has a direct impact on sexual function. Additionally, as indicated increase in erectile dysfunction and other sexual problems was documented in nephrology and myocardial infarction, suggesting that cardiovascular events can exacerbate pre-existing sexual dysfunction. The article also emphasizes the methodology used to select the studies, which included searching databases like PubMed and the easy web of knowledge, and applying towards inclusion criteria to ensure the relevance in quality of the selected articles. This methodical approach provides a solid foundation for the study conclusion in underscores the need for further
Surgery of dysfunction in male patients addressed a topic often has been overlooked in the realm of cardiac surgery, the effect of surgical intervention on sexual health. Entonces, sexual dysfunction is a common issue in patients with cardiovascular disease, especially following surgery. While clinical outcomes of surgery are often the focus, the impact on patient quality of life, particularly regarding sexual function, is frequently neglected. This study is crucial because it highlights how different surgical techniques, minimal invasive versus conventional, affect male patients' sexual post-surgery. The paper notes that minimal invasive approaches might have advantage not only in the aesthetics and recovery time, but also reducing the risk of sexual dysfunction, an aspect in the critical for improving overall patient well-being. The results indicate a significant differentiation between the two surgical methods. In the NEM-PS group, 29.41% of the patients experienced sexual dysfunction compared with the 49.18% in the conventional group. This suggests that the non-conventional group have a lower impact on sexual function, potentially due, potentially due to less physical trauma, early recovery, and fewer psychological barriers such as fear, external damage during sexual activity. Furthermore, the study showed that the patients who underwent non-conventional reported better mental health and less body pain. Like conclusion, the study concludes that invasive mitral valve surgery associated with the allowed incidence of dysfunction and better overall quality of life compared with the conventional surgery. It underscores the importance of addressing sexual health in the post-operative care of cardiac patients and suggests that the benefits of minimal invasive and approaches should be considered when deciding on surgical techniques. In summary, this study adds to growing body of the evidence that minimal invasive cardiac surgery offers substantial benefits beyond the immediate clinical outcomes, improving long-term quality of life by reducing the incidence of sexual dysfunction and promoting faster physiological and physical recovery.
greater attention has recently been paid to the effects this decade has on patients' sex life. Both men and women with atherosclerotic cardiovascular may experience sexual dysfunction because of the connection between the psychological and psychological factors shaped by cardiovascular disease and sexual function. In men, erectile dysfunction is directly related to atherosclerosis. This pathologic process restricts blood flow in the major arteries, including those supplying the penis, leading to erectile dysfunction. Erectile dysfunction not only affects quality of life, but is also an important prediction of future cardiovascular illness, making its early identification and treatment crucial in patients with atherosclerotic cardiovascular. In women, the relationship between atherosclerotic cardiovascular and sexual dysfunction is less evident than in men, which is attributed to lack of objective methodologies in studies. However, factors such as vascular insufficiency in the genital organs and decreased estrogen levels after menopause play an important role in the development of female sexual dysfunction. Many of drugs prescribed for the treatment of cardiovascular disease, such as beta blockers and antidepressants, have side effects to affect sexual function. For example, some anticonvulsants can aggravate erectile dysfunction in men and cause decreased vaginal lubrication in women. On the other hand, phosphodiesterase type 5 inhibitors, such as cindenatina, have been shown to be safe and effective in improving sexual function in patients with atherosclerotic cardiovascular. Sexually, counseling is an important part of the management of patients with atherosclerotic cardiovascular. Good is often neglected, proving a problem guidance on the safe resumption of sexual activity after cardiovascular and can significantly improve patients' quality of life by reducing anxiety and increasing confidence in their ability to safely resume sexual activities. In conclusion, atherosclerotic cardiovascular disease not only impacts the heart, but also affects patient sex life, which can have significant consequences on their overall well-being. Addressing sexual dysfunction proactively and improving appropriate care is critical to improve the quality of life of the patient. More research is needed, especially in women, to optimize treatment in ensure that broad psychological and psychological aspects of sexuality are taken into account.
Broader systemic atherosclerotic process wherever penniless malperfusion represents a manifestation of the underlying condition. This context suggests that might serve not only as indicator of the
of sexual health disease to the women. Good predictor of cardiovascular disease em- emphasizing the necessity for the American College of Cardiovascular disease represent a significant risk factor, reduction growth of the veins. Dice, furthermore, the use certain cardiovascular medication, such as blockers and angiotensin converting enzyme inhibitors can exacerbate